Plantar heel pain, also known as plantar fasciitis or plantar fasciopathy, is one of the most common causes of foot pain, occurring in up to 10% of the population at some point in their lifetime. The plantar fascia is a thick band of connective tissue underneath the base of the foot that connects the medial side of the heel up towards the base of the toes and the metatarsal heads. Tensioning of the plantar fascia occurs as a result of weight-bearing extension of the toes, particularly the big toe. And in doing so, this causes tension in the plantar fascia, which increases the height of the medial arch and puts the bones of the midfoot into a more optimal position to provide a rigid foot. So essentially, when we have tension in the plantar fascia, it helps transform your foot into a very mobile, flexible structure that can adjust to uneven surfaces into this more rigid spring that can help us to powerfully propel ourselves off of the ground. Plantar heel pain arises as a result of repetitive overloading of the plantar fascia and its supporting structures, which results in an increase in sensitivity and pain in the area. Overloading is typically due to an increase in weight-bearing activities. However, this can also be to a change in footwear as well as changes in playing surface or other changes such as sickness, stress, poor sleep, or any other variables at that time. The most common symptom for plantar heel pain is a sharp pain at the base of the inside of the heel, and this is typically worse first thing in the morning when trying to take your first couple of steps or after any long periods off of your feet when initially trying to walk. The pain typically improves with short periods of walking, but then can again worsen towards the end of the day or at the end of any long activities. So if you're dealing with plantar heel pain, the most important thing to understand is that this is primarily a load management issue. So our primary goal is to decrease the overall load that the foot is being exposed to so that we can decrease pain and sensitivity and then increase the tolerance that the foot has to load in order to better keep up with the tasks that you need to be doing. Decreasing overall load in the foot can be done a handful of different ways. Namely, we look to decrease the amount of static loading on the foot, so this might mean breaking up any long periods of standing wherever possible. A relative reduction in dynamic loading of the foot, so this might mean decreasing your overall training load, volume, intensity, or frequency for runners or if you're training. And then additionally, other things that you can look into include soft tissue work of the foot, taping, potentially using a heel insert, or the use of custom orthotics to decrease overall load. Footwear is an important piece of this part of your rehab. Particularly, you want to be minimizing the amount of time spent barefoot or in flat, unsupported footwear. Minimally supported footwear or barefoot training does have a place in the treatment of plantar heel pain. However, this is best implemented later on in rehab when we're looking into more progressive loading rather than while the heel is acutely sensitive. Decreasing sensitivity, as we mentioned earlier, is only half of the story, and a lot of people have been able to implement relative rest for the foot, manage symptoms that way, and then when they return to their activities, their pain reoccurs. And this is because they haven't spent time to increase the tolerance of the plantar fascia in the foot towards load. It's important to spend time doing this, and this is namely done by increasing the mobility of the ankle, the toes, and the plantar fascia, as well as increasing strength in the foot and in the calves. And by doing so, this allows us to make sure that these muscles and joints are able to keep up with the demands of what we're doing day to day with our activities. So we tend to look to start these programs with a stretching program. So we like to start with a brief period of stretching and tissue management from here. So what we look to do, a few stretches that we like to look after are a specific stretch for the plantar fascia, which involves recreating some of that loaded extension through the toes and can also work through a little bit of self-massage work in the plantar fascia while we're in this position, as well as making sure that we are looking after mobility of the ankle and the toes, particularly the big toe, as well as mobility of the calf muscle through a handful of stretches here. As symptoms start to improve, we look to start loading the intrinsic musculature of the foot. And in doing so, we can potentially increase some of the support that's being provided towards the arch and just overall strength and coordination around the foot. So a good exercise to start with on this is a set of towel toe curls, which involves placing a towel underneath the toes and using the toes to curl that towel towards you. A potential regression for this, if it's feeling too difficult, would be using something like just toe switches, which has you placing the big toe on the ground and the other four toes up, and then switching, raising the big toe up and the other four toes down, or even just working through toe spreading just to get those intrinsic muscles working and moving a little bit more regularly. And as you get better at these, you can move into something a little bit more functional, such as this exercise that has single leg balance plus some resisted flexion being supplied by a band, which has us working again in a bit more of a functional position. As you progress towards the later stages of your rehab, we begin to start working into some modified calf raises. We use the towel here underneath the toes to cause some of that extension of the toes and tension the plantar fascia so that we are forcing it to be loaded in this tense position and causing us to increase a little bit more of that resilience in the tissues as we move through these exercises. If those are feeling too difficult, you can start with a seated banded version of this where we still have the toes extended and are moving the calf muscle to get a little bit of the strength through there, but not working in weight bearing. But ideally, as we progress through these, the goal is to add more weight to these, move on to a single leg version, and eventually add in a step so that we are working through a full range of a calf raise with heavy weight and with tension in the plantar fascia. So if you're dealing with plantar heel pain, it's important to know that it's not unusual for this condition to linger around for several months on occasion. That being said, the prognosis of plantar heel pain is favorable, with over 80% of people responding well to physiotherapy treatment and less than 2% of people needing surgery down the line as a result of plantar heel pain. The most important thing you can do is find somebody who understands the condition and understands your specific deficits around it, and then you can put together a plan with them and stay consistent with it for at least 8 to 12 weeks, at which point you will be noticing some potentially slow but definite improvements in the condition.